Well, good morning, everyone, and a really big thank you for joining us up here on such a beautiful sunny morning at the Emory rooftop. So nice to look out and see all of this green sort of spread around us, and a really nice backdrop to a conversation on longevity. I'm sure you'll all agree. I'm Francesca Oghuman-White, and I'm the founder of the Beauty Triangle. Now, we're here this morning to unlock longevity and really examine how we can support our hormones, our health span, and our overall happiness. After all, what is the secret to true vitality? Does it lie in the quality of our skin? Is it the brightness of our eyes? Is it how we carry ourselves on the day-to-day, or in our posture? Or is it a little deeper than that? Is it something about how we connect with other human beings and in the energy that we all give off? Now, we'll come to answer that soon, but for anyone who's new to the Beauty Triangle, a little bit of background. We launched very much as a way to educate and empower our audiences on all aspects of their health and well-being, and always from a holistic standpoint. But we also wanted to have the conversations that no one was really having in the space, and in doing so, connect you with the most trusted voices in the world of well-being, so that you can make safer and better informed decisions. On that note, it gives me great pleasure to introduce this morning's incredible speakers. I'm joined up here by Medical Director at Surrenne here at the Emory, Dr. Mark Mikhail, Aesthetic Doctor, founder of Secret Aesthetics and regenerative expert, Dr. Zoya Awan, and finally by functional medicine practitioner and gut health specialist, Farzanah Nasser. And together we're all going to be unpicking the subtle, nuanced cues that really denote agelessness, while also looking at the more cutting-edge, pioneering routes to really understanding longevity a little better, from the role of diagnostics and biohacking therapies, through to restorative treatments and injectables, all the way through to the role that the gut-brain axis plays. So I think hopefully all of you should have found a program on your seats. That's got a little bit of information on all of today's speakers, so you can learn a bit more about them, all of their Instagram handles. If you'd like us to connect you with anyone that you hear speak this morning, you can let us know. There's also a little QR code on the flyer on the back as well, so you can reach out to us that way. And if you're not signed up to all of our wonderful news that we're always communicating, then that's how you'll do it. You can find it all on there. We'll have time for audience questions at the very end, so anything you want to ask our brilliant speakers, we can save until the end of the discussion. And finally, we have an amazing goodie bag for everyone here. It's filled with treats from Surrenne, which is really exciting, and also an incredible supplement called New Road 30. It's a new supplement and it's packed full of 30 different plants to really increase fiber intake, which I know Farzanah will be very excited about as she's going to be speaking all about this, and also optimize brain function, cognitive function, and overall longevity. So really one not to forget on your way out. Anyway, enough chat from me. I'm going to pass over to our brilliant speakers. They'll say a very quick hello, and then we'll get started with the main conversation. So, Mark, over to you.
Well, thank you for having us, and thank you for being here. I'm Dr. Mark Mikhail. I'm, as Francesca said, I'm the medical director here and the global scientific lead for Surrenne, and I'm founder of a healthcare company called 3 Peaks Health. There's a little bit of everything, but a big focus on health and lifespan maximisation.
Really exciting to have you here. I can't wait to pick your brains. Thank you. Dr. Zoya.
Hi, I'm Dr. Zoya. I am an aesthetic doctor. My background is in clinical research, and I was a histopathologist in the NHS, so a lot of skin cancer work, and then I moved solely to the private sector. I've been doing it for 10 years. I specialise in ablative laser resurfacing and a lot of regenerative medicine, and I'm based in Birmingham. My clinic's exclusively with Harvey Nichols.
It's a very, very glamorous clinic. It's the reason to go to Birmingham, I always think, is to see your clinic. And Farzanah.
Hi, I'm Farzanah Nasser. I'm a nutritionist and a certified functional medicine practitioner. I specialize in the gut, hormones, longevity, and skin.
Amazing, nice and succinct, thank you. So we'll get started with Mark. He's our first speaker to be in the spotlight. Like I said, very excited to pick your brains, Mark. But I'm fascinated to know a little bit more about the patients who come to see you, what they're seeking, and I suppose how you go about starting that initial consultation and really getting under the skin of what it is they need.
Yeah, well, it's a full spectrum really. So, of course, within Surrenne we've got it's a membership, so it's a wonderful opportunity to see people at completely different parts and different. They're going through different things. Their hormones might be at different stages of their lives. They might be ready to kick on with kids, or they want to work on performance, or think about cognition, etc. So we see a really big variation of people, and some people want to be very kind of natural and think about behavioural change and nutrition, etc. And others want to be fully juiced up and do all sorts of strange things. So we're really there to kind of curate all of that and trying to cut through the noise and give them guidance on how that should be and give them access to various different modalities.
That's really interesting. And I guess as well alongside that goes a little bit of reality as well for those people that you said probably just want to really hit it hard and sort of maximise themselves, make sure that they're doing things in a safe and sustainable way.
Yeah, and not in a... There's a lot of places that just do everything at once, and it becomes very confusing for the person. I think for me the biggest thing is to sort of, they open their cupboard and it's just full of stuff, full of supplements, is to say, right, well, let's hold back on things, let's actually get to know your body really well.
Yeah.
And it's more about this iterative process, and that's the kind of the opportunity here is to iterate. You know, you start with something slowly, you work out what works for you and what doesn't work for you, and then you kick on and try something else, and you add in what you need when.
You're right, and it's funny. I think it's very much about stripping it back and sort of taking that trial and error approach to your own body as well, and not just relying on the doctor the whole time. I mean, you said to me you sometimes spend like half a day doing consultations with patients, right?
We do. I mean, the minimum time that we'll spend with someone is sort of typically 90 minutes for that first consultation. It's 2 hours, but if including all of the testing and functional testing, then it's half a day to.
And when it comes to the functional testing, what are the things that you're really relying on to get that idea of a patient's baseline health? Yeah,
so within 3 Peaks and in Surrenne, we would think about the things that are sort of correlate with wellness and longevity over the years, and you think about VO2 max, grip strength, flexion, eyes closed, eyes open, balance, dead hang ability. Those.
What's that one you said?
So
dead hang.
How long you can hang on.
Oh, I see. Is that a marker of longevity?
It's a good marker that can track over time.
Because I've heard about grip strength, which makes sense, and we did a talk recently and somebody said grip strength and sort of quadriceps strength are the two most important things. So you can always do things for yourself and you can always walk, but I haven't heard of the hanging. I think I'd fail.
Just with all these... no.
That one, drop.
You're not competing against the world, you're competing against yourself, and it's about improving yours over time. Whenever you do these markers, you need to be thinking about something that is reproducible.
Yeah.
You can do anywhere, and so grip strength is perfect. You know, you have a machine, use the same machine, use the same device each time, and you know that you can do it. You know, it's the same thing. You're gonna be in the same position. Same with dead hangs. You're gonna hold on, and you do it at the same time. And so because it's reproducible, you can compare to your previous.
Compare like for like.
Yeah, exactly, and you can do it again. You know things have improved or
want to integrate into the gym routine. What about the microbiome analysis you do? Because that's quite an interesting one.
Yeah, so our role really is to partner with labs, services, clinicians, facilities that we think are doing things in an exciting way. And so our microbiome partner is, I know everyone talks about AI, but they've actually trained their model properly, published in plenty of journals, but also I actually had one of the old Google tech engineers who did all their AI work have a look at what they've done, and he sort of gave it a stamp of approval as well. But what they do is, where the analysis happens doesn't really matter. So it goes off to a lab in Korea actually and gets shotgun sequenced, so it's a genetic analysis. So you can pick up the full spectrum of bacteria that you have within your gut. But then what they do is this goes through this AI model that they've trained on thousands and thousands and thousands of cases, and it does this sort of delta analysis and says, right, how do we take this person's microbiome, what micronutrients do we need to feed these particular bugs, the good ones that we want to propagate, and what should we deprive the bad ones of, to take this microbiome from here to perfect. And so it then gives kind of 400 food groups ranked to then say, these are the things that you should focus on, and say, it allows you to make food switches basically. You say kale is a 10, but your spinach is a 3, that's
start
So,
prioritising.
right, well,
And you
focus on
said
that.
to me it's interesting because it sometimes interferes with what people think they should be eating, or things that they think, no, I'm intolerant to that, so I shouldn't be having that.
Yeah, and so of course, if there's something that they're intolerant to, then we would avoid it. If there's true intolerance to it, then we would avoid it. But for slowly building their microbiome back, and it does like a market search on which probiotics and prebiotics would be most suited to them as well.
Yeah.
I think it's a very powerful tool. It does take a while to go through and explain how that works, because it's not a typical microbiome test. It's not saying what do you like to eat, what do you not like to eat, and what typically, like, you should have more asparagus, blah blah blah. It is truly saying what do the bacteria want to eat.
Yeah,
it's
exactly.
literally about that. It's sort of ignoring the human.
What your bugs want, yeah. You're not part of this.
You are not relevant.
I love that. Really strip it back. You're also a really big fan of peptides, which I'd love to chat about. What are peptides and how are you using them for your patients?
Yeah, I'm a big fan of peptides. So peptides is a sort of basically an umbrella term, really, for around 7,000 different compounds that are out there, but it's a chain of amino acids, essentially, and specifically in the peptide world, it's a short chain of amino acids. Mm-hmm. And if you think about a medication or larger polypeptides, they are large, and they are, if you think about the way that they work in the body, they're going around, and let's say this knuckle will hit one receptor, this piece of my knuckle might hit another receptor, and so that's the development of side effects, because you're not quite so targeted. Whereas peptides, some of them may be 3 amino acids long. And the level of precision that you can have when you're utilising them I think is incredibly impressive.
What sort of treatments would you use them for?
I mean, there's kind of something for everyone.
A little bit of everything. I love that. What can we all have?
There's peptides. Probably the most famous ones are BPC 157, TB 500 for soft tissue recovery and for immunity. Mm-hmm. But there's peptides across the range. So we'd often start with a peptide calendar and maybe focus on the mitochondria with SS31 to start with. But if their goal was muscle building or body recomposition, then you think about the growth hormone releasing ones that support the growth hormone release in a sustained way.
So when you say a peptide calendar, is that literal? Like you actually have like the year for somebody and you map it all out with what they need at different times?
Down with them and say, what are your goals now? There's some sort of blanket rules that you might follow at the start anyway, but then you develop, you think, right, towards the winter season, you might focus a little bit more on immunity and thymosin or something like that, or when you can really tailor it. Stuff for libido. There's things for everyone.
And how do you administer it? Is it all injected?
Because they are proteins and small proteins, they don't do quite so well in the gut. Okay. So apart from a few of them, which their oral bioavailability is not too bad, the majority of them need to be subcutaneously injected.
Okay,
but, I mean, there's developments in the
I guess it's always changing.
Patches and things like that are coming on. So
and I think you said to me when we were discussing peptides as well that you only ever want to be on one for sort of a short period of time, and then I suppose never become too dependent on it. So
it's also
what do you
the
do
same
at that
for
point?
a lot of other things that we take. If we're making them, you don't want to take something that your body's supposed to make consistently, because your body will stop making as much of it. So, if you think about glutathione, for example, we do make glutathione, and so I don't typically have people taking glutathione forever, like consistently. I want them to have a break, and actually this applies to a lot of things. I want them to rein back on certain either supplements or adjuncts at certain times. You rein back a little bit, make sure that your body's still making it. And the same applies for peptides. So you would typically do a cadence of sort of 5 days on, 2 days off, 8 weeks on, 8 weeks off. Of course, if there are some that your body's not making, and so you can carry those on. But
I suppose it goes back to that. You often talk about like the seasonality of your life and just finding the things that fit in at the right time, and
absolutely
allowing it to sort of be bespoke to you in that way.
And that relies on a honest and good relationship and connection with the patient.
100%.
That's why that conversation takes a while, because it does take a little bit of time to trust someone and to then be happy to talk to them about those things that are a little bit personal. We spoke about the libido. It's sometimes difficult to talk about that.
And sometimes to even remember it yourself. I mean, I can't, I've lost count of the number of times I've sat in front of a doctor and, you start talking about things and then you get half an hour later, you're like, oh, and this other thing. And you almost start to join the dots yourself a little bit, but it's not until you've got somebody who can really guide you through that consultation that you start doing that for yourself. You touched on supplements a little bit, and I wanted to ask because there have been so many interesting new longevity supplements sort of coming into the scene in recent years. I mean, NAD, NMN, sort of somewhat related, methylene blue. Are these supplements that we should all be looking at taking to promote longevity? Are they suitable for everyone, or what are your thoughts? Sorry, big question.
No, it's a big question. So, I mean, some of it's price dependent. We've all need to pick the things that are the biggest bang for our buck at the different phases of our lives. So I don't think everyone should be on everything. But there are also contraindications to all of them. I mean, everyone's sort of said NAD is ubiquitously useful for anyone over the age of 40 because our levels do decline. And so a lot of these correlations in research are saying, okay, well, if your levels decline, then pick your levels up, and that will then improve longevity. And it's not particularly robust, but NAD has got some good, robust evidence for it. Now, it does steal, this is one example in people, it does steal methyl groups, and you will all have heard of this sort of the methylation cycle. Probably would have heard of the methylation cycle.
Quick explanation, just in case we haven't.
It happens.
Don't know if I have. No, I'm joking.
There's a few people that talk about it a lot. That's probably why. So it happens billions of times in bodies, and it's essentially body's ability to kind of process and methylate. So add methyl groups to, say, folic acid and B12, and so one of the ways that you can kind of detect it is either doing a genetic test, but also in your blood, your homocysteine level will rise if that cycle's not working particularly well.
Yeah.
The cycle's incredibly important for so many, across all organ systems, but for so many different processes. And one of the ways that NAD works is it needs methyl groups for some of its processes. And so for someone who's already struggling with that cycle, you can actually be dragging methyl groups away from a cycle that's already struggling, and so potentially there's an impact there on that cycle, which is crucially important. So there are some people that actually feel worse on NAD.
It's so good to hear you say this, because it really goes back to that idea of you have to sort of respect your body and also let it sort of do its thing and not interfere too much as a human being, because these processes are what our bodies are supposed to do. I mean, you can support them, but you can't interfere too much.
Yeah, and we also, any doctor that says that they know the answer every single time, they're probably trying to sell you something. So,
what about the methylene blue? Because it's weird. It only just came onto my sort of radar a few months ago, and since I've spotted a few people with you can always see people have taken it because they have a blue tongue.
Yeah, or if you are next to them in the urinals, not that the ladies should be, then they'll have blue pee as well.
Oh,
but it's definitely effective. Methylene blue. For example, there's another group of people, so methylene blue increases stomach acid production. So there's some people with like gastritis or ulcers or have reflux that will actually really struggle with methylene blue as well.
Yeah.
But, as an adjunct, I think it's really useful. You can also have it IV.
I was going to say, is it sort of best to do these supplements orally, to do them through an IV, to inject them?
Yeah, I mean, the fact that if you're taking it orally, the fact that your pee goes goes pretty blue shows that there's a decent amount that's sort of
getting in
the
there.
system and bioavailable, to be fair, because that's gone past your the metabolism. So, the IV space is booming, and it's very quick. It's a very quick way to do things. But we have people on methylene blue more regularly on capsules.
Not everyone wants to be hooked up to a drip.
Not everyone wants to be hooked up, and do I know what the right answer is and what the best one is for that? No, because it's a little bit spurious as to what's the outcome measure that you're looking for. It's
exactly.
difficult to really put your finger on it.
Can we talk a bit about cognitive function and sort of trying to feel very sharp, eliminate the brain fog, be really switched on sort of mentally, because you're one of the first people I feel like really in the UK to be doing this, but really using some interesting brain sort of simulation devices now to, I guess, manage age-related decline, but also enhance that high-performance mindset. Is that something that would benefit all of us, and how is it really working?
So I think one of the main things that people say, most of the people that I see eat well, they exercise, they have good social interaction, they've got very good support structure, they've got a lot of the things right, but one of the things that they're most worried about is cognitive decline, and certainly sort of disease-related cognitive decline as well, so Alzheimer's, for example.
Yeah, of course.
And so I think the next stage is for us to really be focused on brain health, cognition, mood regulation and wellness within that space. And of course, Farzanah will speak about that within the hormones and functional health, and the the brain-gut axis is incredibly important to that as well. But we use a whole host of different things. So, for example, for a start, there are peptides that we've used, but we would often also within the peptide space do a course of something called cerebrolysin, which is actually for stroke patients, but it's there to enhance something called brain-derived neurotrophic factor. So it's all about increasing, and there's a pretty shocking statistic, but also an encouraging one, that within Alzheimer's patients, for example, they lose 40% of their synaptic connections. That's the arborization, so the branches between the neurons and the pathways. They lose 40% of the connections before there's any actual neuronal, so actual cell loss. And so that's worrying, but it also gives you this encouragement to say, well, what are the things that I can do to increase synaptic connection? How can I ensure that those pathways continue propagate? How can I maximize them? And we spoke about one of the things for that when we were on the phone. One of the things is social interaction, creativity. People talk about brushing your teeth with your left hand, standing on one leg when you do it, finding a new route home. Those are sort of the ways that all of us can do it, but then within the kind of the device or slightly more biohacking world, we do transcranial electromagnetic stimulation, so that's putting an electromagnetic force through an area called the dorsolateral prefrontal cortex, which is involved in mood regulation, but a lot of high function processes as well, and that really stimulates synaptic connection. We stack that by inhaling hydrogen at the same time. So hydrogen is a tiny little molecule that crosses the blood-brain barrier, which is this barrier between the blood and the brain, but it's mopping up free radicals, and we all produce reactive oxygen species as part of what our mitochondria do. That oxygen is toxic when it's in that form, and so they'll mop up these free radicals. And so we try to stack the two, so give your brain the best opportunity to create these synaptic connections, and then after that you put on a photobiomodulation helmet, so it's a red light helmet to further stimulate the synapses. And sometimes I'll also give an IV of a few things at the same time.
Oh my God, this is amazing.
Like
supercharged really after all, this will be flying off the roof. I love that. And I know that Zoya is going to talk to us later about sort of how she treatment stacks. It's really interesting because we talk about it all the time in aesthetics, but the idea of treatment stacking for your cognitive function, I love. But that's also important because we shouldn't be doing any one thing in isolation anyway. Everything works collectively. I want to finish off by asking you about the social wellness element that you mentioned, because I think that's really key, and I love how you sort of suggested trying new things, like really fostering that sort of neuroplasticity, sort of as we sort of call it. How do you sort of help your patients to, I suppose, live on a clean slate to the best of their ability, but also still sort of cultivate that social wellness, sort of have those connections with loved ones? Because I think it's so easy in the world today, we are quite disconnected. We're all on our digital devices. We're all working all hours under the sun. I barely see my friends at the moment, which is really sad, but it's just a stage of life thing. So how do you go about sort of trying to help your patients see that that is actually a really important part of their health journey as well?
I mean, I think it's about giving them permission to do that, really. And I'm not, their authority, but I'll give you an example. I saw a friend's parents, and I wouldn't normally see two patients together at the same time, but they were friends and I knew them, so I did. We were going through their bloods, and chap's wife was saying, Mark, can you tell him every Thursday he goes out with his friends, they've been doing it for 25 years, they meet in the pub and they have a pint, tell him it's killing him. I think that's literally the best thing I've ever heard in my life. I absolutely love it. It's probably the best thing for his health to do that.
It's the thing that's keeping him alive.
I think, like I said, about getting to know them as well as you can, it's about then saying, right, here are the areas where I really do think you should reduce your risk and stop doing this. here are the areas where there may be risk, but actually there's benefit. I will try to ameliorate the risk that might come from that. And so you think about going out and having some drinks, well, I'd say, okay, well, maybe after that you have dihydromorecidin afterwards or something like that. You know, there are ways to ameliorate risk still, but still get the other benefits of it. And
what was it you just said we should have after drinking?
Dihydromorecidin.
Okay.
Yeah.
How do we take that? Asking for a friend.
Yeah. I mean, it's actually not that popular in England for some reason. It's not really available in England, but you can get it. You can get it on Amazon, I suspect. But it's fine.
Great.
So it's
Amazon Prime.
It's fantastic. If you're thinking about the things that mop up alcohol and help process it, dihydromorecidin has got to be up there. So I don't tend to bother with the milk thistle and the glutathione stuff after when I get hungover. So I tend to take dihydromorecidin before and one after, and I wake up and I'm full of beans. So
it's a very important thing to know, how to manage the hangovers and the alcohol at the same time. It's all about social wellness and balancing that with looking after our health. Thank you, Mark. That was really, really interesting.
Pleasure.
And any questions for Mark, we'll come to a Q&A section at the end of this.
Thank you.
Thank you. So our next speaker is Dr. Zoya Awan. She's incredibly renowned for her aesthetic artistry, her regenerative treatments, and everything that you do to help us feel, I suppose, like the best version of ourselves inside and out. But I'd love to sort of pick your brains on this. What do you think denotes sort of agelessness in society today? Because I think we can probably all agree it's not about the face devoid of lines or personality or movement. Like, what are patients sort of asking for when they come to see you?
So let's be clear, agelessness is no longer about being forever 21, looking forever 21. It's not about policing every line, every wrinkle, or every evidence that we have of our face, of a life that we've lived. I mean, I'm not here to get rid of every single smile line. I'm not here to do that. Agelessness, to me, it's a feeling that transcends all ages. It's that mind, body, health, nutrition balance that links together and makes us feel a certain way.
Yeah, agreed.
And to answer your question about what I would do for patients, the conversation is not about anti-aging. I don't like anti-aging, anti-wrinkle. Aging is not a naughty word anymore.
No, I agree. It's something to be celebrated now.
It's to be celebrated, and it's a conversation about looking age appropriate and
agreed.
Feeling good from within. And that's the key here. So, for instance, sometimes patients will come to me and they'll have a photo of Kim Kardashian, they'll have a photo of somebody of what they want to look like, and then I'll say, put that away.
Yeah.
Okay. And a lot of my clients are in their 40s and 50s, and I say, can you show me a photo of you when you liked yourself the best? And show me yourself in your 20s and your 30s and your 40s, and let's see how you aged and how we can restore that.
Yeah.
So that's what agelessness means to me.
It's a really beautiful way of looking at it as well, and sort of looking inside and trying to bring out the best of yourself versus comparing ourselves to other people and chasing these sort of, I don't know, inconceivable ideas.
It's so important because of the generation we live in. You know, you see these teenagers, they have social media, these filters. That girl doesn't look like that. You know, that's a filter. You know, we're creating such unrealistic expectations for women and men and anybody, but we've always had unrealistic expectations.
Yeah.
And we don't now with social media and filters and everybody looking like a copy and paste of one kind of person. We're creating unrealistic expectations. So it's important to go to a practitioner who's going to strip that back, not take advantage of your vulnerabilities, and be honest with you and say no.
Yeah.
It needs to.
100%. I think it's interesting because sometimes patients come to see you, I imagine, in your clinic, and they're there for a very sort of physical attribute, but it's always worth trying to understand or unpick how it is that somebody wants to feel at the end of that. I think that's what it's all about. I mean, would you agree? I think we've seen the conversation shift in the world of aesthetics very much from beautification, age management, more towards skin health and longevity, and that really proactive approach. How has that sort of resonated with your practice, and do you think that's something that you're starting to really embrace within your clinic as well?
Absolutely. So the best work is undetectable work. Now, if you go down the streets of London, downstairs you'll probably see at least 5 people with their lips out there, their bum out there, lips out there. You'll remember that work. It's obvious work. But the best work is undetectable. And the best work does work on the skin health. Now, the best way to approach that, and if you're picking a practitioner, they should be talking you through things in an easy way. So what I say to my patients is your skin, your anatomical structures, your support framework for your face and your body can be split into layers like a cake. Okay? So you've got your icing layer, you've got your sponge layer, you've got the base. They all have different ingredients. Now, to work to look the best and feel the best and look natural, you must replace each ingredient in each layer in the right ratios correctly. And each layer needs different treatments.
It's so true. In the same way that we spoke about treatment stacking with the cognitive, it's treatment stacking for your face and your skin.
And the reason why fillers and aesthetic doctors these days are getting a bad reputation is because nobody is looking at it like that. So hyaluronic acid-based fillers are not your enemy. They are not. But what's happening is a lot of injectors, it's a quick fix. You go straight in, you see a result. They're putting too much hyaluronic acid in. If you look at your skin, the dermis, about 80% is collagen. You've got 10% elastin. You've got a smaller amount of hyaluronic acid. We do lose all of this. Our skin cells do start to go into sleep from 25. They're retiring, but we need to replace all of that in the right ratio so we get the right tasting cake.
Agreed.
Does this make sense?
100%. And also you've got to remember it's bone, it's muscle, it's fat. You know, it's not just sort of soft tissue. And I think we can't always be sort of looking to volumize, but actually sort of respect all of those different layers. I'd love to chat about that a little bit more, but I also want to understand a little bit about how you, I suppose, do your treatment stacking, because this is something that you're very, very into. How do you go about sort of looking at the patient in front of you and deciding exactly what it is that they need?
So treatment stacking isn't about selling your patient lots of treatments. Treatment stacking is about addressing that layer cake in the right way and in an appropriate way. And I think actually, Francesca, for this particular question, it would be really useful if I could show you, because it is a visual. Does everybody have their phones? Access to Instagram? If you go onto Dr. Zoya, I pinned this for you.
Amazing.
I pinned this for you. If you go to Dr. Zoya, spelled D-O-C-T, like the word Dr. Zoya, and pin the very first photo at the top of a lady, if you can all get that up, and if you slide across those photos, I want to showcase what I did for her. So let me know when you're all there.
You showed me this photo, and it's quite incredible what you achieved.
Yeah,
sorry, we don't have one.
I gave my phone in. Oh God.
You can slide across. So if you've all got this lady, I want to talk you through this case because it really answers your question. And it really does link into as to why an aesthetic doctor is here talking about longevity and health and wellness. So this particular lady, believe it or not, she's only 60 and her skin health came up at 73. And she
that was when you used sort of like imaging to sort of understand what her skin health.
I'll definitely touch on the use of imaging. It's really helpful. Now, like a lot of patients, when they come in, they notice one thing. So a lot of people come in, oh, the lips are bothering me, or this bump is not bothering me. She actually came in for an endolift treatment. She wanted to have a non-surgical procedure for some loose skin down here. But my job as the practitioner is to help her see what the bigger picture is. So then we did a deep dive in the consultation into her motivations, her background, her lifestyle, because you don't start looking like that at 60 just overnight. So if it doesn't happen overnight, there's no one treatment overnight that's going to fix it. So when I did a deep dive into her health, her BMI was 16.5. She had been in a domestically abusive relationship. So secondary to that, what did she do? She turned to alcohol. She turned to smoking. She became a single mother raising 3 children. So she was working 2 jobs. So her face and every single line on her face tells her story.
100%.
So it was a 6-month journey working with a nutritionist, working with her bloods, having a look, making sure she had COPD. She needs to optimize her health. You don't go straight in and start, hey, let me put some lip filler in, love. It doesn't work like that. So you have to work from within and understand the state of her mental health. Understand that you're doing the right thing. What was her motivation? You know, to understand all of that. And over 6 months, using multiple treatments, lasers, Restylane skin boosters to improve the hydration, Restylane fillers I'll go into why I love Restylane, but Restylane fillers to restore that volume in a way that was natural for her. And I got her to show me her photos from her 30s and 40s, and she looked more like that. So we were restoring things in a way that suited her face structure.
It's such a nice sentiment, and I think it really goes back to the idea of just trying to do these treatments and go on these treatment journeys in a very slow and sustained fashion. Like, we have to get away from this idea that there are fast fixes to these things. Like, this is something that has grown and it's developed hand in hand with your expertise over time for her.
And the thing is that when you pump too much filler or do too much too soon, that's when it starts to look obvious, that's when it starts to look big, that's when you run into problems.
It's very much about the technique, isn't it?
Technique. And if you give the same paintbrush to 10 different artists, they're going to paint you 10 different pictures.
Yeah, it's
know
such
your
an analogy.
injector properly,
Yeah.
and go see their work and what kind of work they do.
Can we talk a little bit about hyaluronic acid filler? Because I think there's been a lot in the news. People are having it dissolved. People are saying, get it out of my face. But on the flip side, I still have a face full of hyaluronic acid, I have to say. But I think it's also still a very valuable tool in your toolbox. Am I right?
Absolutely, 100%. Again, going back to the artistry, it's about it's what filler you do use. Ask your injector if you're going for a consultation, what do you use? Why don't enough people ask what is going into their freaking face?
Because people are too scared to challenge a medical expert.
But
and we need to break that down.
Not all fillers are made the same.
Yeah.
They don't have the same safety profile or the same research or the same data.
Yeah.
So you should be asking your injector, excuse me, what are you actually putting into my face?
Yeah, exactly.
Most people don't know. When they come to me, I'm like, what did you have before? But I have no clue.
Yeah.
So I use Restylane. If you do some research into Restylane, it's the chef's kiss. Honestly, it is. They have 50, 60, God knows how many years of research, safety profiles. They have all of that. And now that we know that fillers are actually more semi-permanent, they do last a long time. You want to make sure you've got something that is safe. It's not going to cause you delayed onset granulomas, other complications. And there's a whole range within that portfolio that allows you to address the different dynamics,
the different layers of the cake.
Different layers of the cake.
Yeah, beautiful.
So that it integrates beautifully and looks natural. Filler can be natural. You just need the right quality, right technique.
And you said that earlier, you said it's all about undetectable treatment. So how do you go about doing that? And sort of what areas of the facial anatomy are you looking to support?
So often, very, very frequently, people will come in for the lips or the nasolabial folds or hollowness under the eyes.
Yeah.
These are the first few signs of aging, and they want that filled like a plaster on top. They want it filled and gone.
Yeah.
But very rarely does that give you satisfaction. Because the issue that's causing these problems is actually what's going around in the scaffolding all over your face.
The actual sort of bone architecture.
So your skin is like a mattress. The more springs you have, the firmer that mattress. And we're losing those springs, everything's sinking and sagging.
Yeah.
So by the time you get that line, the mattress has been sinking up here. By the time you get the hollow, the mattress has gone down here. So you need to understand the anatomy and the dynamics of it and how each individual ages is completely different. So there's sinkers, saggers, wrinklers, that's how I say it. So some people wrinkle, they're normally the sun worshippers, more Caucasian.
I think I'm a sagger.
Some will sag, some will sink, they get more hollow. So to be undetectable, it goes back again to the individualized approach.
Yeah.
Seeing their photos and how they've aged, their genetics, their ethnic background, respecting all of that, not creating features that aren't respectful of their ethnicity, and often targeting foundational support areas. Such as the temples. So people coming up and they're like, oh, I've got a problem here. Actually, we need to look at maybe the preauricular area, or you've got some early hollowing, some foundational structural support.
And people are often surprised, I think, when you go to inject like the temples or even sort of back in the hairline. You know, there's a lot of doctors now doing filler in the hairline just to sort of hold everything sort of up and elevated and in the place that you want it. I think it's always educating that patient and helping them to understand why it is that you're doing these things.
Yeah.
We also know that the longevity of these products is greater than we initially knew. So how has that influenced how you're using products like these injectable fillers?
So we have to shift our mentality and not see it any longer as, this is just a reversible thing that I can just get dissolved if I don't like it. You have to see it as a semi-permanent scaffold that is going to alter the dynamics and the aging process of your skin and the layers that we were talking about in the cake. So you need to be more mindful. Your technique needs to be deeper because it's the superficial layers that will start moving. And that's why you see technique matters, right? So a lot of practitioners are seeing patients 5-6 years down the line after having tear trough filler, which is often injected too superficially, and that area moves. That area moves over 5 years. So then they're coming and they're seeing filler down here, it's migrating.
Yeah.
Because the technique is important and the filler quality is important. So that's what so now that we know that filler is a dynamic semi-permanent part of the structure, you have to treat it like that and also preempt how that might move depending on where you're injecting it and how.
Yeah, that makes perfect sense. It's interesting, so I think we're definitely seeing the world of aesthetics colliding very much with longevity. So we've had this whole new category of regenerative medicine, regenerative aesthetics. What are the ways outside of the injectable products or outside of the filler that you're actually regenerating the skin and enabling it to work that little bit harder for itself?
So, what's really interesting is that the skin is an extremely intelligent organ. It's just as intelligent as the brain. You spoke a lot about brain training. If you don't use it, you lose it. Skin training, you have to use your skin cells and keep them awake.
Yeah.
If you think about it, it's the largest organ, it's the first line of defense, its responses are so rapid. You cut yourself, you've got a scab within an hour.
Yes.
If you've got an infection, you'll see it and feel it straight away. So it needs that stimuli.
Yeah.
But if we give it too much stimuli, we can cause scarring, we can cause skin barrier damage.
Yeah.
So it's gentle, like we talk about gentle exercising, gentle brain training, 5 minutes a day. It's gentle stimulation for your skin to keep them awake, because your skin cells do start to go into retirement. They get bored from 25. So by 25, if you're not using them, they're like, oh, I'm going to sleep.
Yeah.
So then the natural moisturizing factors start to shut down, so you get drier. That's why most people are dry by 50.
Yeah.
Then your collagen factories start to shut down. And then if you're smoking, if you're a sun worshipper, that's going to accelerate from 1% to 5%. So to get the brain, to get the skin to be trained and optimize, you need to look at your lifestyle, your diet, everything that these guys are going to talk about.
Yeah.
That's prevention, because consistency over intensity, but you need to do in-clinic treatments to keep them awake, and that's what I call like collagen stimulating treatments. You may have heard of some of these buzzwords: polynucleotides, exosomes, Sculptra, which is the best thing ever, and there's so many. I could go into them separately and explain their differences, but all of these are aimed at skin training and keeping your skin cells awake, improving their inter-skin cellular communication to keep them awake, almost like text messaging to each other. Are you awake? Are you awake? Yeah. And then keep them producing the good stuff that they need.
It's that connectivity, isn't it? And it's interesting because I think we've seen a lot of weight loss, and you spoke about your case study who had the BMI of 16.5. Which is, that's incredibly low, and it goes to show that actually there is a place for these sort of stimulatory treatments whereby we can get the skin to sort of replenish itself and I suppose just sort of pick itself back up after sort of incredible weight loss, GLP-1s. Sometimes just simple lifestyle elements. Sometimes people just doing too much exercise, eating too clean a diet, it can really show on our faces. How are you combating that in patients?
First thing is education. If you're going to someone who's going straight to the needle, first of all, then that's not right. Because even with that lady, we didn't get all that volume back on her face just by pumping filler or things like that. We worked on her diet and we improved her BMI over 6 months. So you need to train patients to understand the importance. Your skin is a living, breathing, evolving organ. It is the largest one. Now, if we know all about nutrition and diet and supplements and how that affects your gut, your heart, it's the same for your skin. So you need to feed it from within.
Yeah.
But then you also need to educate the patient that if you lose a lot of weight, the fat pads are going to shrink really rapidly, and that's the scaffolding for your skin layer. So everything will slip, sink and sag. So how are we going to start restoring that? We are going to need some filler, but we will also need to bring those mattress springs back up. So that's Sculptra. There's multiple things. Again, going back to that cake analogy, you need to look at how that person has got to that weight loss, what educational conversations do you need to have on their lifestyle. There's no point talking to a high-flying businesswoman who's only got 5 minutes in the morning, telling her about doing a 20-minute Korean skincare regime, or telling her to do some gua sha or something. You have to take all of that into consideration.
Really look at the patient in front of you.
Exactly, and then you create something for them, just like you were talking about. So you have to look at 90-minute consultations, you were saying, right? Understanding that person, their lifestyle, what they're going to do when they leave your door.
It's got to be about personalisation now, and I think in an era of AI and sort of data-influenced everything, actually that human interaction is where people are going to get the best results, that personalised, bespoke approach.
100%.
I mean, discounting the 20-step Korean skincare routine, you said, how can skincare...
No one
has enough time in the morning for that.
No.
What skincare are you advocating to really help our skin to look better and last longer in the sort of game towards longevity?
So consistency always trumps intensity. So a 3-step skincare routine in which you're using sunscreen every single day, or you're getting, some sort of collagen stimulation at night, some actives which are right for your skin. That every single day in low doses is going to do much more for your prevention and preempt how you're going to age and determine that. Than coming into the clinic and pumping your face with lots of stuff that's going to last.
But it's the slow and sustained versus the fast fix.
But do you know what really helps me to help the patient understand? Again, when you're an aesthetic doctor, a lot of people will come to you saying, this line's bothering me, this is bothering me. I use something called the Galderma's facial assessment score. So what happens is it helps you open the conversation to your patient, because often they come in with one problem that they're hyper fixated on, but actually they need to understand what's going on with their skin health. and what they need to do for collagen, or other things that are apparent to you or that you know that they need to treat. But how do you open that conversation with the patient without making them think you're trying to sell them something?
Yeah, exactly.
And then the facial assessment score is basically you sit with the client and you mark out different aspects of your skin health out of 3. So what do you think about this? So does this bother you? What do you think about your skin laxity here? How is your skin dryness? And you will put it all together and you'll map it all out and you'll create a final chart that the patient can then refer to.
Yeah.
And then I actually use AI-driven skin analysis machines like the Vizia.
Yeah.
Because not only have you then, after the consultation, helped the client see what you're seeing, but then when you put them under these machines, they actually show you what's going on under the skin.
Yes, exactly.
What
You can see
hasn't
the
come to the
underlying
surface.
redness, you can see the pigmentation that's
What
about to
hasn't come
creep
to the
up. It's
surface.
quite scary.
And we only do start to go and see a doctor when something is visible or obvious on
That's
our
so
skin,
true.
whether it's a rash, whether it's a cut, whether
We're still
it's
very
a
reactive,
lump or a
aren't
bump.
we? Sort of
We are.
rather than being sort of proactive about managing these
And
things.
to answer your question, it's prevention rather than cure.
Yeah.
So if you come to me and you're 60 and your skin's hanging down here, it's not much I can do at that point. I can try and change your habits, but I'm not going to be able to lift it back up without a surgeon.
100%.
But if you come to me and we're talking about your skin health in your 20s, 30s, before we start seeing those signs, then we're going to do better.
And it's also a really nice approach, because I think what it does is it enables the patient to be a part of that journey and that conversation. And I think knowledge always empowers us, no matter what part of our body we're learning about: skin, gut, body, brain. So
knowledge allows you to make the decision.
Yeah.
Rather than, we don't have this traditional mindset that the doctor's always right, or you go and see the doctor,
Exactly.
they prescribe you something. You should question, you should ask.
Exactly.
Why though? Why are you telling me this? And they should explain it to you so that you feel empowered to make that decision for you.
100%. That was amazing. Thank you so much, Dr. Zoya. Fascinating as always. And any questions for Dr. Zoya? She'll still be here at the end, I hope. So our final speaker is Farzanah Nasser. She's a functional medicine practitioner, gut health specialist, and I think I'm right in saying very passionate about breaking down nutrition and making it easy and manageable and simple for everyone. But Farzanah, can you just tell us, maybe to set the scene, a little bit about the clients that you see and really what their key concerns are when they end up at your door?
I think when a lot of people come to see me, it's when they've exhausted all other options. So
Yeah.
they've tried the conventional route, things haven't worked. Well, things have worked, but there's still other niggles that are going on. They're not feeling 100%, and they actually want to get to the root cause.
Yes.
So that's exactly what functional medicine is. It's like root cause medicine. You're going upstream to find out what's driving, an imbalance in the first place. It's
I love
driving
that. It's
process.
It's so deeply investigative what you do. I think like all
yeah,
of
like
you do.
all of these guys do, exactly. And then you're looking at, like, when you look upstream and you start working upstream, then not only are you able to correct the imbalance, but it has so many other positive side effects, like more energy, better skin, all these different
It has that sort of cascade, that ripple effect, doesn't it? We always think we're treating one thing, but
Yeah.
actually you get your body into its optimal sort of health, and then everything else just sort of falls into place.
Exactly.
Well, hopefully it does.
Exactly, it has a positive side effect.
Yeah,
from doing all
exactly.
those things as well.
And what about the baseline testing that you do? What are your non-negotiables for patients when you start working with them?
So we'll always start with a blood test and a stool test, so a comprehensive digestive stool analysis and comprehensive bloods. So if you don't know where your blood markers are, like your thyroid, your vitamin D, your iron, all these things are so foundational in feeling your best. So just making sure your blood work is all optimal. Otherwise, whatever you do, you're not going to see the full effect from it.
Absolutely. You haven't turned over every stone to understand how to work with that
so
patient.
doing like comprehensive bloods is really, really important to see what imbalances could be there, correcting them, and then also a comprehensive digestive stool analysis. So we know the gut has an impact on pretty much every single system of the body, and there's so much we can do to support our gut health.
Yeah.
So a comprehensive test will look at things like digestion, absorption. It'll look at good microbes, problematic microbes that could be driving, issues. It looks at things like short-chain fatty acids. So when you eat your food, your plants, you produce something called short-chain fatty acids, and they're very, very anti-inflammatory, impacting things like longevity in your skin. So we can actually measure all of these things in a stool test, and seeing someone's baseline really allows you to work with them.
That's
achieve
incredible.
their goals.
I think the insights you can get, all of you across the board, from all of these tests nowadays, I mean, the information that we have at our fingertips is so powerful.
We're so lucky.
Yeah,
to be
we
in this
really
age
are.
that we have all this information.
Yeah, 100%.
And all these tests.
And why is it that gut health is so pivotal to longevity, but also to sort of our ongoing overall wellness?
Well, there's so much we can do. Like, it's quite empowering because when we think about the gut and then longevity, there's so much that we can do every single day to improve longevity through looking at our gut. There was one study that was done, and it showed that every 10-gram increase in fiber reduced your biological age by 4 years. So we've got a chronological age, which is the actual age that we've lived, like in days and years, and our biological age is like our cellular age. And fiber is able to actually reduce our actual biological age. And if we look at the centenarians, so centenarians are people who have hit 100 and older, they have very different microbiomes to those who are younger. I mean, to those who haven't, lived to 100. And
because they were brought up on a very different diet to what we're eating in this generation.
They have more of they have a more similar gut microbiome to a younger person than they do to an older person.
Yeah.
And even when you look at COVID, they would do some studies that were done, and they found that bifidobacteria is very protective. But as we get older, we lose levels of bifidobacteria. But these are also microbes that we can grow quite easily in the gut. Like if you look at a lot of the studies, all the foods that we eat, as long as they're from like the plant kingdom, they're going to increase all these good microbes. So whether it's like brown rice or green tea or dark chocolate, like all plant foods increase the good microbes that are in your gut and support that balance. But that's a key feature of the centenarians. And it also doesn't matter where you start.
Yeah.
There's studies showing that if you change from like your standard Western diet, and if you change to a Mediterranean diet, that adds years. That's life, to your
life to your years.
Into your life. And even people who are like 70 years old, they were increasing lifespan just by changing their diet, even at 70. So it doesn't actually matter how old you are. You can improve.
I think you said to me actually, fiber is like the forgotten nutrient nowadays, and it's true. Like it's not something that. I don't know, I feel like there's such a focus on protein in the world that we live in now. And obviously protein is fundamental. It's the building blocks of our body. It encourages everything to sort of work in the most optimal fashion. But now all the foods that you see in the supermarket, everything advertised, everything is extra protein fortified. It's almost like we've forgotten slightly about fiber and why that is so fundamental to our gut and our overall well-being.
Yeah. No, absolutely, but we need protein. But I think a lot of people also forget we get a good amount of protein from plant foods as well. But it's also and we're going to need different amounts of protein depending on our age as well, right?
Yeah.
So and where we are, our life stage as well. But fiber is definitely the forgotten nutrient. It's accessible to all of us. And it is. I think we all have. A lot of us have moved towards the ultra processed food, and it's in the news a lot at the moment as well. And that's lacking the fiber, right? And it's lacking the colour, which is the polyphenols, which is also food for our gut microbes.
Absolutely.
So,
you always want to see a colourful plate, right? Not sort of just a beige, brown sort of plate of food.
Yeah.
It's never
all this kind of stuff.
Yes, exactly. All the colour that we have here.
And
we often talk about the gut-brain axis. What exactly does this mean, and why is it so important that we sort of support that?
Well, we've all had that feeling when we get like butterflies in our stomach. We get really nervous about something. That's your gut-brain connection, right? The butterflies.
Yes, exactly.
And the gut and the brain actually derive from the same fetal tissue, and then one becomes the brain, one becomes the gut, and they're connected by a 10th cranial nerve, which is the vagus nerve.
Yeah. Which I feel like everyone is talking about at the moment. The vagus nerve regulation. It's another conversation, but
yeah. And because everyone's stressed, but there's so many things we could do to support that. But our gut and our brain communicate all the time, and the food that we eat supports our brain. So when we eat, obviously we extract our nutrients, our vitamins and minerals and macronutrients, and then the fiber, which we can't break down because we don't have the enzymes as humans, goes to our large intestine. Our gut microbes will break that down, and they produce something called short-chain fatty acids, and then this goes to our brain, and that has an impact on our mood and how we feel.
Because they say all serotonin, or nearly all serotonin, is created in the gut as well.
Well, 95% of serotonin is made in the gut, but it doesn't cross the gut. It doesn't cross into the brain, so it helps with things like motility.
Okay. So that's why you need those short-chain fatty acids.
Yeah,
to get
and
up
so
there,
but the short-chain fatty acids do cross.
Yeah.
But there was a really interesting study. Well, there's so many studies coming out right now, which is amazing. But and they're saying like there's like an increase in fiber by 5 grams a day. So that's about it's like an apple and maybe a few almonds, or like a pear is 5 grams of fiber. So an increase in fiber by 5 grams can potentially reduce your risk of depression by 5%. So
That's
there is,
fascinating.
food has a huge
I think
impact
that
on how
yeah,
we
exactly.
feel.
I mean, we always say food is medicine, but it literally is when you look at the impact on your skin, on your digestion, on your hormones, on your brain health.
It's huge. And like, I think a lot of people think, oh gosh, but you have to have like, it's suggested, the NHS suggests that we have 30 grams of fibre a day. 90% of us aren't meeting that target.
90%
are not meeting
Wow.
that target. And so if you, depending on what you're eating, it can feel a little bit challenging to like, oh gosh, I've got to hit like this 30 grams.
Yeah.
But it's about just starting somewhere. So one study found just increasing your portion of fruit and veg intake by one a day. So like, it could be like one apple or one banana or one pear or one green red pepper, whatever it is, just increasing it by one a day, increased feelings of happiness and well-being. But you have to be consistent, so you have to have it every day. So it actually doesn't
Swapping
matter.
your afternoon biscuit for
an
apple.
An
But
apple with
I
some
think
chocolate, like with chocolate, like even dark chocolate is good for you, but it's just like making little changes and swaps.
I think
Yeah,
you're so right
exactly.
though. It's about the consistency, and Zoya said the same. We have to just be consistent
Yeah.
in what we give the body, because then it starts to reset and relearn. If there
100%.
were, say, 3 foods that we could all incorporate into our diets that would really support longevity, what would those be, would you say, to put you on the spot?
First of all, I think it's anything that you enjoy, right?
Yeah.
If there's anything in the plant world, like, so plants include fruits, vegetables, nuts, seeds, herbs, legumes, spices, teas, grains. There's so much to choose from. It's
And dark
basically-
chocolate, which I'm really excited about, by the way, that you made that part of the group.
Yeah.
Cacao.
Dark chocolate, coffee,
Excellent.
green tea, matcha, all these things count, but it has to be something that you enjoy. So first of all, think, what do I love that I can be consistent with, right? But if I was to pick three really easy foods, the first one would be blueberries. So first you can just go to the shop, you can just wash them. You can add them to anything that you're eating, your like granola, your porridge, your smoothie. Really, just eat a handful
Just eat
of them.
them raw,
Really,
yeah.
really easy to incorporate. But they have so many benefits. So they get their color purple from a pigment, they're anthocyanins, which actually cross the blood-brain barrier. And you can feel the effect of them within an hour. So they've done so many studies. There was one done with children that showed they had 200 grams of blueberries, and within an hour they found that their reaction time improved. Obviously, this was to video games, but we're not playing video games. But it just shows like it
We've
has
got
an
to
impact.
find a way to test kids for like an hour or so, I guess.
I know, but it has an impact within an hour.
And 200 grams, I mean, that's sort of like a punnet, like it's a small box.
Yeah, but
You snack
they're
on those consistently.
yeah, but they're like a handful was shown to have effects. There was the one study. There's so many studies. Like a cup of blueberries was shown to improve cognitive health, lower cognitive decline in older people. So there was a 6-year study with 16,000 people that showed how it improved cognitive function. There are just so many benefits, but
Whether
it's
it's
just
superfood.
an easy food, right?
Yeah,
it's
exactly.
It's not difficult. You don't have to make anything or prepare anything.
Yes.
It's just a quick win, right?
Yeah.
You just buy it and add it to
I'm going to be snacking on blueberries all the time now that you've said
Yeah, yeah, and they're low GI, so they're good for your blood sugar as well. They're going to help keep that.
this. Yeah, 100%. What else? So blueberries, anything else you would recommend?
Greens. So again, it's something you can buy from the grocery store and just add to your basket. So you can get some pre-washed greens. I usually opt for something like rocket, so it's a bitter food, so it stimulates your digestive enzymes as well.
Yes,
it helps
that's
you
so
break them
important.
down. And it's just very easy to take a handful and add them to whatever you're eating. Greens. So greens, lots of foods contain magnesium. So nuts, legumes, beans, but also green foods. So anything green will have magnesium at its core.
Interesting.
Okay. So when we think about longevity, you can have people who don't get enough magnesium, you can have premature aging, right? And there was a study that was done a couple of years ago that showed 550 milligrams of magnesium helped prevented age-related brain shrinkage.
Brain shrinkage?
Yeah,
Oh my
and
goodness.
aging. And this is especially helpful in those in perimenopause and menopause due to the anti-inflammatory effects of magnesium.
Yeah.
So get the greens and get the magnesium in. So you can supplement, but you can also get magnesium in quite easily through your food. I actually just shared a post, I think it was like a few back, on a magnesium smoothie which has 300 milligrams of magnesium. And the only ingredients were like spinach, cocoa powder. No, there were like 5 ingredients, so there weren't many, but they were really high magnesium foods, but they taste really good together in a smoothie, and it's really easy to make, and that was 300 milligrams of magnesium.
I think, you just mentioned like perimenopause and menopause as well, and sort of hormonal sort of shifts, and I think that's where sort of these, the stress, the sleeplessness that comes with some of these shifts as well in our lives. Like, this is where you really need something like magnesium to support and sort of calm the body.
Yeah.
Nature's tranquilizer, I think you always
magnesium.
call magnesium, don't you?
Yeah, magnesium, nature's tranquilizer.
Third food? I want to get 3 out of you.
Can we do chocolate?
Yes, 100%.
So, because you said chocolate, let's do chocolate.
Tell me all about it.
So, chocolate is a health food. It's from like a plant, but it's the way we're having it. It's not actually chocolate, it's more sugar, right? So, studies have shown that if you have chocolate has fiber. Chocolate has a lot of fiber. It has a really good amount of fiber in it. But you have the darker the chocolate, the more fiber you're going to get.
And what's like the minimum percentage we should be looking at?
Like,
because 85% plus is quite like the texture changes, which I don't know so much.
I mean, 70 is really good. So chocolate has polyphenols. Polyphenols is the color pigment that feeds our gut microbes as well. But there was a really interesting study that was done, and they took a piece of like a piece about this big. So like your average, like if you have a piece of chocolate, you probably have about 2 slabs. So it's about that much. So they took a 70% and they took an 80% dark chocolate. And I think it was for 6 weeks, and everyone had 1 piece daily of this chocolate. And what they found with the 85% dark chocolate was that there was changes in the gut microbiome and improved mood.
Interesting.
In the 85%, but they didn't find that in the 70%.
Okay, so we do have to up the ante.
You don't have to, because there's still fiber in it, and there's still polyphenols, and there's still gut benefits. But the good mood effects were found with the 85.
Interesting.
And not the 70%.
I love all of the studies that you just, that they seem to like roll off the tip of your tongue. It's very interesting.
Because I think with food, people don't realize how powerful it is.
Yes, exactly.
It's just,
and as soon as you say, make this change and it will add 5 years to your life, like that is powerful stuff. That is how food impacts longevity.
And that's what we need to know.
Me.
Yeah, because it's just like, we can all do it.
I agree.
And they're easy wins, right? They're not like, we're not cooking a feast. We're like including some foods.
Can we talk a little bit more just about sort of supporting hormonal changes and how you go about working with food to do that? Are there sort of key food groups, nutrients that we should really be incorporating sort of around menopausal changes, sort of hormonal issues that we might be sort of facing at different chapters of life?
Different foods that we can incorporate. I mean, there are definitely foods that we can incorporate that can help during the transition. So we know like our gut microbiomes change, like in perimenopause and menopause due to the shifts in estrogen as well. So just, looking at our gut health is huge, making sure we're trying to get the fiber in, because that's feeding the microbes, right? Fiber is food for the microbes. And so the better we can feed them, the better we can support our gut, and that supports longevity and this transition as well. There are certain foods that can be really helpful too. So ground flaxseed, for example, is a vegan source of omega-3, so it's got anti-inflammatory benefits. It's also, it's considered a colonic food. So it can actually
colonic food?
Colonic food, yeah.
Amazing.
So it's very rich in soluble fiber, and it's soluble fiber that feed our gut microbes. So it's been shown to feed them, increase good levels of different good microbes in our gut. And it's also a phytoestrogen. So phyto means plant, estrogen is estrogen. So it's a plant estrogen, which can lightly stimulate our own estrogen receptors, which can be really helpful at this time too. So, and it's easy to incorporate as well. So you can just add some into your yogurt or your smoothie or granola or whatever.
Exactly, it's finding ways to sort of make these more accessible. I think as powerful as what we eat is how we eat it, right? Yeah, is there anything that we can do actually when we do come to sit down and or we prepare our food? What can we do to actually sort of eat in a more mindful way and support longevity through food?
I think it's just calming our nervous system before we eat. So mindful eating allows us to do that.
Actually taking the time, not eating on the run.
Exactly, because if you're like walking and eating, or you're like, stuck in traffic and you're eating, your body knows that you're stressed, and it can't differentiate whether you're stressed because you're running away from that saber-toothed tiger, or like you're just actually burning the candle at both ends. And so it's not going to send, blood to your gut to help you break down your food. It's going to send it to your periphery so you can run away from that tiger.
100%.
Right? So you need, you want to like think about your food. So when you think about your food, sometimes you salivate. Right? And in your saliva, you have enzymes that start to break down the food, right? You take a couple of deep breaths before you have your meal. It starts to calm that nervous system down, right? So it allows more blood flow to go to your stomach, and that will help you start to break down your proteins and cleave away the minerals from the food that you're eating. So, sometimes thinking of something you're grateful for before your meal, right? Again, calms the nervous system down.
Brings a sense of awareness and sort of presence back to you as well, so that you actually engage with the food in front of you.
And engage with your senses, because they all start to support digestion, right?
I remember
and
going to Lanzahof years ago, sort of one of these medical retreats, sort of Maya medicine, and I think you chew your food like 20, 30 times every mouthful before you're allowed to swallow it. I mean, there's literally like nothing there by the time, but it's so interesting, because I got home at the back of this trip and I had lunch with my husband, and I literally looked at his plate and I was like, where's all your food gone? Because I was still slowly chewing, and it's really interesting how much it makes you engage with your meal when you're eating it in that way.
Absolutely. I mean, we're supposed to chew each mouthful about 25 times, and if it engages with your meal, it helps you break it down better, but you absorb more goodness from the food that you're eating. There was a study that was done.
Of course, I need this on a t-shirt. I love it.
They compared people who chewed, they were given a snack of a handful of almonds, and they compared people who chewed them 10 times versus 40 times. Like 40 times is a lot of times.
That is a long time.
But what they were trying to show was you were getting more nutrition from the food that you're eating. The better you chew it, the better you break it down. Your stomach doesn't have teeth, right? We have to do the mechanical process of actually breaking down the food as much as we can.
It's remembering how the body works sometimes, isn't it? And again, like I was saying to Mark, not interfering, not trying to sort of tamper with the sort of intricacies of that machine and everything that it's doing.
Yeah.
What was my last question for you? Do you also advise people eat in a certain window? I mean, we know a lot about intermittent fasting and how that can sometimes support longevity, done in the right way. Is it also about timing when we're eating, times of the day?
It depends. I think, we're all fasting, right, at night while we sleep. So we're all naturally fasting. And we want to try to make that fasting window like at least 12 hours. If we think about gut health, there's certain microbes that, thrive in the fasting window, right? So if we're not fasting, we're not allowing them to grow. So one like Akkermann's is a really important one for longevity and metabolic health. It kind of grows in a fasting cycle. But longer than that, it really depends. So, I try to do like a 14 to 15 hour fast every night, but it really depends. So on
what you need as well,
and
your
what
energy
you need and
levels.
what life stage you're at, because some people it doesn't suit them. So if you're going to fast and have a large fasting window, but you're feeling irritable and hangry, and then that's taking too much pressure on your adrenal glands, so it's not going to be a benefit to you. So I think it's quite personal.
It's understanding your own body and what works for you, and also different chapters of your life where you may be doing it and other times where you're not.
Exactly, but I do think we need we all should all have a 12-hour fasting window. Anything more than that, it really
I guess that's where also the gut sort of resets and sort of regenerates itself, right?
Yeah. Exactly.
Final question actually. What about sort of social eating as well? Is there also logic to, I suppose, being more in a social environment when we eat as well, sort of going back to social wellness and the importance of that in longevity?
I think it's one of the pillars that we see a lot with the centenarians as well, right? Is that they have people, they have the community, they have, they're eating with like younger people, with older people, community, everyone's coming together and enjoying food together. So,
having conversation and not just making it about the food, but it's about the experience of it all as well.
And that's calming for your nervous system too, right?
Yeah, exactly. Just having other people there with you. Yeah. So true. Amazing. Thank you so much, Farzanah. That very much brings us to the end of this morning's conversation, and I have to say it was super interesting for me. I learned a huge amount listening to the three of you. Hope everyone here as well did. It strikes me that, in a conversation about longevity, which is obviously packed with the super sharp end of the science and the biohacks and the data-led, the AI and all of these amazing studies that you've spoken about as well, Farzanah, that this could also be a conversation that was very much focused on the science and the pioneering, the cutting edge. But actually what I love is that all three of you really sort of drilled down into understanding the patient you work with and almost encouraging that knowledge sharing between the two of you, which goes back to social interaction and why it's so important that we're not just looking at machines but also looking at human beings. We do have time for questions if anyone wants to ask any of our brilliant panelists anything. Oh yes, straight away.
Thank you very much, Francesca. Very interesting as always panel, and thank you very much speakers for great insights. I have actually a small question for each of you. For Dr. Zoya, if you can recommend any effective habits or lifestyle changes or just rituals to support the skin longevity and regeneration for the skin, so you can easily implement in the lifestyle. For Farzanah, what's your view on functional mushrooms? The reishi, cordyceps, chaga, I know they're kind of really popular. What do they do with the hormones? Are they messing up? Are they helping? What's your view? And for Dr. Mark, I saw here you're also expert in hyperbaric oxygen, but you haven't mentioned it today. I was wondering whether for the healthy person, is it good to do hyperbaric oxygen? Could you just do too much oxygen and it actually can do the reverse of healthy?
Should we start with Mark and then just go down? Everyone remember their question?
I thought I was going to have enough time to think about it.
Oh no, sorry, I put you straight on the spot.
It's okay. It's actually a great question. So, as I said about oxygen being potentially, being this toxin as well, our longevity lead doesn't like the use of oxygen. So she's called Dr. Sandy Kaufman. So she's quite anti-oxygen, not just generally, but she's quite anti it in terms of hyperbaric. There isn't any evidence out there to suggest that hyperbaric is harmful, and certainly there's thousands and thousands of studies better than that. If you type into PubMed, which is where you do a literature search, if you type in hyperbaric oxygen, and basically any condition, you'll find something, some benefit to it. I think it's another consistency is more important, intensity, and so if it's something that you're only going to do once a month, it's probably not going to give you or denote much benefit for you. There are other sort of ways of getting some benefit as well. I mean, there's some great tech coming out of the US that do hyperdissolve nanobubble technology, oxygen, and you can have that in your pools and your plunges. And
wow.
So if there are
I love how
benefits
it's creeping into our homes as well.
Yeah, absolutely. I mean, they've got some great systems there, but I think it's definitely a good therapy, but you need to do it consistently to get much benefit.
You hear about a lot of people using it pre and post surgery.
Yeah,
hyperbaric oxygen.
The stuff around injury and that, the reason I know about it is I'm a dive master, so
really,
it was
wow.
from
Man of many talents.
From sort of the dive. Oh no, I just pissed off to the Philippines for 3 months, and it was quite nice. So, but I was sort of the dive doctor there, so I had to run the decompression chamber. So kind of picked up knowledge from that, but. For injury recovery, certainly for diving, it's been around for a very long time, but for injury recovery, there are innumerable benefits. So, for soft tissue healing and for muscle recovery, so that would be the same for post and pre-op. That ability to, at high pressure, oxygenate tissues, that's why you recover from injury so quick.
Interesting. So
and then chuck in some peptides and you're away.
Oh yeah, stack it all together.
Yeah.
Skin rituals.
So a few things that are generic that's applicable for everybody. Sunscreen, most people don't know that you have to reapply every 2 hours. Doesn't matter whether you're spending £100 or £1. And it's equally as relevant when you're indoors on a hot day with a big window like this. And a lot of people then say, I'm wearing makeup, what can I do? There's sunscreen sprays, these are aesthetically a great one, that work on top of makeup, there's powders, you need to keep on top of the sunscreen because that's what's going to accelerate. If you're coming to the clinic and you're getting all these collagen stimulating treatments or using retinol or you're using peptides, whatever, and you're trying to stimulate that collagen, but then you're not protecting your investment and you go out and you're in the sun or you're driving in a car with the window and it's breaking it all down, you've just lost your investment. You've lost your ROI. So that's one thing. So secondly, most people think that they're drinking enough water, but they're not. 2.5 to 3 liters for an average sedentary adult. If you're active, then you want to make up for the excess water loss through sweat. If you drink a lot of caffeine or dehydrating agents, then you might want to, if you have a shot of coffee, have a shot of water after. You have to keep your skin hydrated from within. If you think about it, like if your skin feels dry or dehydrated on the surface, moisturize is a quick fix. It's not treating the underlying root cause, and your skin, if you go to the gym, you exercise and you don't drink enough water, you won't perform as efficiently. You won't be able to last as long. It's the same for your skin. It needs to be hydrated from within, so that's why the water is important.
I remember my acupuncturist saying, plants need water to grow. Think about the human body in the same way. Don't deprive it of water. Yeah. Every time you see something and it's abundantly growing in nature, there's water.
Yeah. And the final thing is, I know we know about sleep, but do you know about the consistency of sleep and the importance of that in regulating your hormones? The skin and everything regenerates and repairs itself better while we sleep. So it's not just about getting enough. If you're getting 8 hours, but you're getting it on random, that's why shift workers, I can't quote a study off the top of my head, but shift workers are shown to have worse health outcomes because it's that consistency of sleep.
I think it's something like 7 years less lifespan for night shift workers.
Something like
Yeah.
that. Yeah.
I think that is a study that I do know.
There's hundreds of them actually.
Yeah, it's quite
It's
solid
really
data on that.
It's quite impressive, actually.
Can I just add on the hydration thing? A common mistake that people make though is when they're then trying to increase their hydration, they forget to sort of front load it, and they end up doing it and trying to catch up in the evening and then disrupting their sleep.
Yeah, because then they're up
they
and
need
going down to the loo
they
all
need to be
night.
on it. So front load it and try and get as much of it in as you can before lunch, and then just a little bit less.
Yeah, that's a good point. Farzanah, we were talking about
Mushrooms, functional mushrooms, yeah, they're amazing. For all stages of life, there are different ones that work really well. So reishi is considered the mushroom of longevity. And so that's a really nice one. I love that one. And even like for perimenopausal menopause, that can be, it's probably the most supportive, and it helps to modulate like different systems as well. So it can help with hormones too. Lion's mane is also a really nice one. It's good for the gut. It can help with the gut lining, the gut integrity. All the mushrooms contain beta-glucans as well, which are a fiber that helps support gut health and feed the microbes as well. And they all have slightly different qualities. Like chaga is good for energy, so I usually have that in my, like you can have the concentrated version and the pills that you take, which are really great taking them. But you can also have ones like chaga is quite nice for energy, and I have like chaga mushroom just with some warm milk in the afternoon as a pick-me-up instead of like a coffee or a matcha, which is a nice one. But yeah, they're great.
Are most of your clients taking mushrooms as a part of their medicinal mushrooms?
Some of them, it depends, it's so individual, it depends what they need. So, you know, they're really good for immune health too. So I work a lot with immune health, so we put some in, we need to support immune health as well. So, but like, reishi for like longevity, but it all depends on where they are, what they need, but
exactly.
They're all brilliant. I love the mushrooms. Yeah.
Were there any more questions?
Like eating nuts, you feel that activating nuts. Does it make any difference activating nuts?
Yeah, I mean, there are some anti-nutrients in the nuts, right? So if you actually soak the nuts and you eat them, you can't stop eating them. Like, they just taste different. They just taste really sweet. And
so it's just not a marketing point?
No, it's not. No, you can. Because there are some anti-nutrients in them, so they actually taste better. You can absorb more of the goodness from them too, if you can. You don't have to do them. I don't generally do them. I do it sometimes with walnuts because it really does transform the taste, and it takes away the tannins, so the bitterness in them as well. But the bitterness also feeds the gut microbes. So it's, it's different. It depends what you're trying to gain from it, but it does increase some of the nutrients that you can extract from the nuts when you soak them. But you will lose some of the tannins, which feed the good microbes. So,
and what are your thoughts on inulin? Because I tend to add inulin to my podcast.
Inulin?
Yeah, for fiber.
Yeah, I mean that's great. It's it's a fiber. And some people like that, as long as you're not reacting to it, because that can make you a bit bloated and stuff. But it's quite a nice one, and it's a nice one for kids as well because it's sweet tasting, right?
Were there any more questions? Oh, one more in the front, I think, and then we have to finish.
Dr. Mark, you mentioned dead hanging. For, say, someone that's at the age of 70, what would you recommend their length they should aim for? Keep trying to get my mum and dad into it.
Well, like I said, it's actually
impressive at 70 if they'd be doing that. Wow.
Yeah.
Yeah. Good for them.
It's more about just trying to beat yourself, to be perfectly honest. I mean, there are graphs, people, I wouldn't be able to equate them to you, but really what you're trying to do is to say you're dead hang on month 1 and you're dead hang on month 3. As long as it's better, who cares what the rest of the nation are doing with the rest of the population, because all of these studies, they have their benefits, sure, but they've not all of them have been structured particularly well. Some of them, the cohort that they've selected, like for example, a lot of the biological age tracking stuff, so the epigenetics tests that we do, they're used on a cohort in Cali of very healthy individuals who are super focused on their health and wellness. And so I'll sit down with someone and they'll be like, why the fuck is my biological age like, 10 years older than my actual age? And that's a difficult conversation to then say, well, actually, no, this doesn't actually match the international population.
I mean, they need to redo that, because that's just...
They're trying to, and
unfair.
they're getting better and better and better, but beating yourself is the most important thing.
Yeah, good idea. Great. I think that's probably all we have time for, but all of our panelists will be here, I'm sure, for a few more moments afterwards if you'd like to ask them anything else. But just a few final thank yous from me. Firstly, to everyone at the Emory for hosting us so beautifully this morning. It was such a perfect venue for this morning, so very grateful for our first event here with the Beauty Triangle. To everyone in our audience, it's been amazing, bless you, to have you all here, and we'd love to see you at more of our events. We're hosting them all throughout London and also now in Dubai, so come to all of those, sign up to the website. You'll always be the first to know when and where we're hosting them. And finally, to our amazing Beauty Triangle for all of your insights and your expertise and your incredible eye-opening knowledge.